Hi, I'm Stacey. Joining me today is Alexis Steele, health educator at Public Health Department. Alexis, thank you so much for being here today.
Thanks for having me, Stacey.
So why don't you give us a little bit of an introduction to what the Public Health Department does for the community?
Definitely. So of course, as a health department, we have a bunch of different environmental health functions.
Okay.
So we're responsible for licensing and inspecting all 288 food service establishments in Wallingford.
Okay.
Of course, we have to make sure that they're clean, that they're safe, and that they adhere to state and federal standards.
Okay.
So we have 3 sanitarians that stay very busy inspecting the food service establishments.
Okay.
We also have to inspect and license tattoo parlors, beauty parlors, nail salons, barber shops. We also, and there's about 80 of those.
Okay.
So
On top
busy.
of the 288. Mm-hmm. Awesome.
And then we also take care of the daycares. We make sure those are safe and clean and free of lead.
Okay.
We also look at pools. And we look at pools in apartment complexes, condo complexes, and hotels. Make sure that
Okay.
they're safe, have proper signage, and all their chemicals are good.
Oh, awesome. And then you do lead poison prevention. You were talking about the daycares.
Yeah, so lead poisoning prevention is really important for children. So children can get lots of, cognitive issues and growth developmental issues
Right.
if they have high blood lead levels. So we have 3 certified lead risk assessors
Okay.
that will go into the home and conduct a lead risk assessment, bring dust wipes, see where the problem areas could be that a child with high blood levels could have gotten their lead poisoning from.
Okay.
Another cool thing that we do is we offer a low-cost food safety manager certification, and this is a requirement for each food service establishment to have at least one person on staff with the certification.
Awesome. And they can just go right to the health department and find out when those are taking place?
Yeah, we offer them probably once every season, so we'll do, winter, summer, fall.
Okay. And that's at a lower cost to them, or?
Yeah, it's at a lower cost than most other places. So.
Okay, wonderful. And then for tick processing, do you guys do anything with ticks?
We do. As you know, Lyme disease is a big problem in Connecticut especially. So if you ever find a tick on yourself and you don't know what kind of tick it is, because deer ticks carry Lyme disease,
Right.
You can take off that tick from your body, make sure it's dead by putting it in alcohol, put it in a little sealed bag, bring
Okay.
it to us, and we'll send it off to the state lab for testing and see what kind of tick it is and if it carries any disease.
And then you can go from there.
Yeah.
Awesome. Now that we've gone over a few of the ways that you assist the community, why don't we talk about creating a healthier Wallingford?
Definitely. So, at the health department, I am the health educator. So I'm responsible for community health and wellness initiatives. So this really cool committee that we have is full of town leaders, and we focus on how to make Wallingford healthier and better in any way possible. And first, it started off as Healthy Wallingford 2020,
Okay.
which is modeled off of Healthy People 2020, which is like a federal kind of program.
Okay.
So then we decided, hey, we don't want the good stuff that we do to stop being highlighted after 2020.
Right.
So we changed the name to the Community Health Alliance.
Awesome. And what are the main areas of focus that they focus on?
So technically, the committee focuses on the Wallingford Health Improvement Plan.
Okay.
So this is a plan that was formulated a couple of years back to highlight the 10 essential services of public health. Mm-hmm. And the 4 areas that we've kind of focused on as problem areas for Wallingford are healthy housing. So healthy housing includes asthma, lead poison prevention, falls prevention, and emergency preparedness.
Okay.
Then we also have a behavioral health section. So this has teen dating violence, suicide prevention, and substance abuse.
Right. And I think those are really important subjects, especially to talk to the middle school kids and the high school kids about, because I don't think that they are really aware that it's out there.
Yeah, you're so right. And it's really important to just give, education and resources to kids, adults, everyone in the community.
Right.
Then we also talk about healthy lifestyles and active living in the Wallingford Health Improvement Plan.
Okay.
So this would be obesity, COPD, physical activity, nutrition, and substance abuse, again, falls under healthy lifestyles and active living. So that's another important part.
Right, right. And then eat, play, and unplug. Let's talk about that.
That's the last focus area in the Wallingford Health Improvement Plan. And, it's really important that as a community and as a family, we teach our kids and maybe try to focus a little bit ourselves more on eating healthier, eating together, playing more together, and having lightheartedness with your kids and your friends, and unplugging. So making time for just getting away from the electronics and
Right.
making some personal connections.
Right. Play a board game. Go for a walk.
Yes.
Ride your bike.
You're already a pro.
Wonderful. And then from Eat, Play, and Unplug, you guys also came up with the Choose Kindness initiative.
Right. So Choose Kindness really, it encompasses kind of those Eat, Play, Unplug things we just talked about. Choosing kindness is something that is almost easier said than done sometimes.
Right.
And, a lot of times you don't see people exemplify choosing kindness at, when you go to the store and, interact with strangers. It's just even as simple as, smiling at a stranger or helping somebody with their groceries. There's so much you can
Absolutely.
do to just choose kindness, and we want to make choosing kindness a big part of being a Wallingford resident or coming to visit Wallingford.
Right. And that way, even your neighbors are very important. You should meet your neighbors,
Exactly.
help your neighbors.
Because they can help you one day when you need it.
Right, exactly. Well, now that we're creating a healthy Wallingford, what about if there's an emergency?
Yeah, very scary possibility. So I'm also responsible, and the public health department plays a big role in emergency preparedness in Wallingford. So to address this, we have a core group of community volunteers we call the Medical Reserve Corps,
Okay.
also known as the MRC for short. And the name can be a little bit misleading because, Medical Reserve Corps, well, I'm not in the medical field, so
Right.
I don't have to be a part of that. But we're looking for all different kinds of people to be on our Medical Reserve Corps. So if we ever had to, let's say, vaccinate everybody in town because there was an infectious disease threat, we would
Right.
need to set up a points of dispensing operation.
Okay.
And not only would we need people to help us vaccinate, we need people to, triage all the incoming community members, to hand out waters maybe, to be greeters. So we need all different kinds of people to help us out in an operation like this. Also, setting up a shelter is something that we'd be heavily involved in, that we would need, bodies to be there to help us out. So we have our people to, call up, say it's an emergency, we're calling all our MRC members.
Okay.
And in response for being on our list of people to call, we offer them free trainings to
Okay.
keep them, updated with the best skills. And we offer self-defense this year. We're doing self-defense, that's something new.
Awesome.
What to do until help arrives.
Okay.
CPR and AED training always fills up really quick because it's free of charge. We do
Right.
free first aid, mental health first aid, and honestly, so much more. So
Right.
it's really beneficial for us to have MRC members and for you to be an MRC member.
And all of those volunteers, if they want those trainings, they're all free of charge?
Yeah, which is
Awesome.
awesome. We're always expanding our learning, and it's a great way to be involved in your community and almost be a local superhero if we ever did have an emergency. So
Right.
feel free to reach out to me by email. Are you guys going to have the email on the screen?
Yes.
All right, perfect. So go ahead and send me an email if you're interested in becoming an MRC member.
All right. And if they want to link over to your page on the town website, you would just go to the town website and they could see all of the information that we've talked about as well?
Exactly.
Okay. And then we have a few more minutes, so what about a matter of balance?
So a matter of balance is something I really wanted to talk about because it's a class I'll be teaching with the public health nurse, and we're also recruiting people to become coaches. So a matter of balance is an evidence-based program for seniors. So falls are the leading cause of injury for seniors in, all across America. It's a
Right.
really scary thought that you're a senior, you have a fall, you could be stuck on the floor for days, and it's a matter of balance is a great way to address fears and to change your attitude and to have, fellow community members help you out with your, concerns about falls. And it's an
Right.
8-week program. It's run at the senior center. We had it in the fall, and it was completely full. We had a waiting list. So
wow.
we're offering it again in the springtime.
Okay.
And we're really excited about that at the Public Health Department.
Awesome. Now, with the matter of balance, that's also a good thing about choosing kindness, because if you are an elderly who's fallen on your floor, if you know your neighbors, that's a great way for them to check on you.
Yeah, absolutely. It's a great way to have a system with your neighbor to maybe call every day, just check up, say, hey, how you doing? Have a
Right.
good day. Bye.
Right.
It can
And
be
if
just
you-
as simple and quick as that, and it could honestly save a life.
Right. That's amazing. Well, we have about a few minutes left. Is there anything else that we may have missed or that you really want to promote?
Just choosing kindness. I would really like to promote choosing kindness in the community. Come see us at Celebrate Wallingford. The Public Health Department will be at a booth again. Last year we had a whole Kindness Rocks booth. So we got like 500 rocks, painted all these rocks up, and encouraged everyone walking by to just write a little nice message. You know, hug your neighbor, be a good friend,
Yeah.
smile. And we put them all in a little Kindness Rocks garden.
Yep.
Actually, it wasn't so little.
The whole front of the town
the
hall.
whole front of the town hall covered in colored rocks.
Yes.
But it was really sweet, and people walking by just got some encouraging messages, got to take a rock. So we're going to do something fun and special again, promoting kindness at Celebrate
good.
Wallingford. So come see us and choose kindness.
Awesome. Well, thank you so much for being here today. It's really been a pleasure.
Been a
You're
pleasure.
welcome. Again, I'm Stacey Hoppus. Thank you for joining us today, and I'll see you around town.